Welcome, everyone. I know some people might still be joining, but we'll get started. My name is Trina Budd, and I'm the Manager of Health Services at Algonquin College. Before we get started, I'm going to share a couple of housekeeping items. So this event includes live closed captions in English. Captions are available directly in the Zoom toolbar by clicking the CC icon. You may also have to click on Show Subtitles. Along the bottom of the screen, you will find a chat button. Feel free to use this feature if you have any comments that you would like to share with us. If you have any questions for us, you can type them in the Q&A tab along the bottom of your screen. We will allow good time at the end of the presentation to answer all of your questions. Please note that the presentation will be recorded and a link will be posted to the Health Services website. I do want to also note that Algonquin College's counseling team is tuning in today. So if you are experiencing feelings of stress or worry, we encourage you to connect with a counselor during this event. You can do this by navigating to the chat tab, selecting the To in the drop-down menu, and then AC Counselor. This will let you send a private message to counseling. From there, one of our counselors will be able to offer support. So now it is with pleasure that I transfer you over to our Vice President of Student Services, Laura Stambra, to introduce our guest speaker.
Thank you, Trina. I appreciate that. And just going to jump over to my notes because I have some nice, lovely introduction and a warm welcome to everyone joining us today on this beautiful, bright, sunny day, which is always something that makes us feel good. So everyone, we are thrilled to have Dr. Susan Farrell with us today. And Dr. Work and in your daily lives. And this topic is one of the areas of focus under the National Standard of Canada for Mental Health and Well-Being for Post-Secondary Students. The standard was the first of its kind in the world, and it is a set of flexible but voluntary guidelines to help post-secondary education institutions support mental health and well-being for students. Dr. Farrell is Vice President of the Patient Care Services at the Community Mental Health at the Royal Ottawa Healthcare Group. She is delighted to oversee the Royal's telemedicine program that enjoys its innovative partnership with Algonquin College, which we're so proud of, and now provides virtual mental health education to colleges across Ontario. For the past decade, Dr. Farrell was the inaugural clinical director of the Community Mental Health Program at the Royal, supporting the provision of care in the community. Dr. Farrell is a licensed clinical psychologist in Ontario and Nunavut, and for almost 2 decades, her clinical work, research, teaching, and advocacy has been focused on improving care for persons with mental illness and dual diagnosis within community-based models. She is an associate professor in the Faculty of Medicine and clinical professor in the School of Psychology at the University of Ottawa. Dr. Farrell has completed her graduate studies at Acadia University and the University of Ottawa and did her residency at the University of Manitoba, specifically selected for rotations in rural and northern communities, including delivering care through telemedicine. Dr. Farrell is a certified health executive with the Canadian College of Health Leaders, and in 2018, she was awarded the Excellence in Training Award for the Canadian Council of Professional Psychology Programs and was made a fellow of the Canadian Psychological Association for her national contributions to psychology and society. Susan is an active community volunteer across many social justice, education, and mental health and youth initiatives. And in her spare time, an avid traveler, pre-COVID, I'd like to mention, an experimental cook and a proud mom who's learning to embrace downhill skiing and camping in order to keep up with her adventurous adolescence. So now we see why I needed some notes to make sure I captured all that. We really are happy to have such an exceptional speaker with us today. So thank you, Susan, so much for joining our mental health during our Mental Health Awareness Week, and we truly appreciate it. And now I will turn the virtual mic over to you. Thank you.
Thank you very much, and thank you for the invitation. As mentioned, I'm delighted that I have the opportunity to play a few different roles within the telemedicine partnership between the Royal and Algonquin, something that we cherish at the Royal and are really appreciative and proud of working with you. I'm also really impressed to take a look at the focus on mental health and well-being you have on your campus, not just in weeks like this, but overall, and grateful for your time to explore this important topic together. So my hope is to spend about half an hour sharing some information from the recent science and other clinical practice areas that take a look at these topics: resilience, its relationship to mental health, and the fact that this title of the talk almost looks like it's giving you a big promise. It might even feel a little bit like an infomercial, and it's not designed to be that. What it's really designed to do is either to start you on a path towards building your own resilience in the places where you work, go to school, and live, or perhaps strengthen your commitment to the path that you're on and give you some extra considerations to build your resilience, encourage you possibly to change direction, or maybe some of all of it. It'll focus on building your skills. So let's talk a little bit about resilience. What is it? And sometimes I get asked, does it really matter? Or more importantly, can I order it on Amazon? And the reality is, resilience is something different for everybody. But this picture sort of says it best. Out of something that seems like concrete without any opportunity can come a bloom, can come a new skill, a new moment, and something to be really proud of that you can grow and cultivate. That's your resilience. So here are some important quotes. They're not mine, but please feel free to use them if they fit for you. The idea is that resilience is building the ability to keep getting up, being proud, and moving forward. I like the one in particular that talks not only about how success is measured, but also just very simply put, it's falling 7 times and getting up 8. And falls can look very different at different times in our lives. There are very serious things from which we need to build resilience. Serious life events, losses, and important things or mental health supports can be critically important to building your resilience. But sometimes resilience is just dealing with daily hassles. And how do we bounce back from some of those? Let me give you a short story to illustrate. It wasn't one that I was even planning to have for this talk. So I have the great benefit of a lot of wonderful friends who enrich my life in many ways. And one of my dearest friends is one of your colleagues, Michelle Tate Ebern. Now, if you know Michelle, you know she's got a very wise mind, a wonderfully big heart, and a fantastic sense of style. So when I knew I was being asked to give this talk at a time when because we share, a hairdresser was closed due to the provincial lockdown, I got a little bit worried. But Michelle to the rescue, she sent me some important tips. So this morning, I woke up extra early. I thought, how would Michelle do her hair today? How would Michelle think about these things? Then I went out, to my delight, to see quite a lot of snow on my car. And as I was brushing it off and getting ready to come into work, I noticed there was a patch of ice under the snow on my driveway. Now, I didn't notice it ahead of time. I noticed it after I performed an Olympic award-winning somersault on the ground through a snowbank and rolled and rolled and rolled. So much for the hairstyle. So then I thought, uh-oh, what am I going to do? Can I get back in the house and try this all over again, or do I need to get to work? So that's a humorous example of falling and getting up. But the reality is, resilience is the story that we tell ourselves. The fact that we say to ourselves, it's okay. I'm sure there's something like a Zoom filter that they can just kind of use, only to come to work and discover your Zoom filter has been disabled. Only to then come and realize, oh, that hairbrush you packed, your adolescent daughter's borrowed it yesterday and it's not in fact in your briefcase. And then we move along. So there's good news and bad news in resilience. You're not born with it. So that's good news because it's not too late to develop it. It means something different for everyone, but you are very capable of developing resilient skills or sharpening your skills to help you in different settings. But in order to develop and practice resilience, you have to go through difficult times. It's not an insurance policy that you can ward off anything challenging to come. It's the belief in your skills and your ability to reach out, get the help you need, and believe in yourself to keep working through the challenges that you might face at school, at work, or in your life. So if you look up the topic of resilience, what you quickly notice that there's lots of different models and theories and examples of resilience. Where to start? I think the best place to start is to understand that resilience is in fact a personal journey. And you'll do best if you understand yourself. You find your 3 A's, which is what I'm going to speak about today, and then you plant and grow your own resilience tree. How is it that you are going to cultivate the growth of resilience that will help you and build skills in school, work, and life? So the first A is being aware. It's really important in building resilience skills to be aware of a few things, and most importantly is the relationship between mental health and resilience. And in understanding that is to also understand the stigma that sometimes still surrounds mental health and how it is addressed. You may know some of these very unfortunate facts about mental health in our community. By the time Canadians have reached the age of 40, 1 in 2 have had mental health problems, mental illness. In any given year, 1 in 5 Canadians experience a mental health or addiction problem, and 11 suicides are estimated to be committed every day. So mental health is in all of our lives. It's in every setting where we are, school, work, and in our families and relationships, and it's something we really need to pay attention to. It affects all ages and genders, but it is still the case that too many people suffer because they don't know how to get help or where to get help. Now, in building awareness about mental health, there's lots of information about signs and symptoms that you can quickly find on the internet, or more importantly, by talking to folks at health services and counseling services. But that first thing to be aware of is that everybody goes through stressful and difficult times. So the reality is you need to figure out for yourself, when is too much just too much? How do I make a decision that I need to address my mental health in order to build my resilience? So here are a couple of considerations. Maybe it affects your sense of yourself, your relationships with other people, your ability to perform at school and at work. Maybe it affects important things like your sleeping, thinking, and eating, or coping. But I also want you to be aware of what might keep you from getting care, making sure that you understand that when too much is too much, you both deserve care, but you also have the ability to access care. Don't let stigma keep you from getting care. We would never ask somebody who is being investigated for cancer whether or not they really needed to get care. We feel the same way about mental health. Now, I'd like you to take a look at this for a minute, because this is also part of the how much is too much. We call this the stress and anxiety curve, the performance curve, if you will. And what it really means is that we do need certain amounts of stress in our life to have our highest performance, or the top of that curve. Simply put, if you were in the low part, you probably wouldn't have great performance. Imagine in school, if all of your instructors said, hey, there are no real deadlines for this. This isn't actually ever really due. Would you go rushing home and get your assignment done? Most people work to a deadline. Most people need a certain amount of stress in order to get their schedule organized, get them organized, and work to a deadline. But be careful, because sometimes too much stress is exactly that. In the category at the bottom here where it says high stress in fact leads to low performance, low health, and mental health issues. So what we need to know is, how do we become aware when we are moving ourselves on that stress curve? When is too much just too much? Because when we move that way, what we start to see in ourselves and in others is the experience of symptoms of anxiety and depression. So where and how do we experience anxiety and depression? If you're wondering about this for yourself or someone else, please check in at services on campus. Please read some of the online resources. But consider the fact that we can experience anxiety and depression in a number of different ways. In our thoughts, are they changing? In our feelings, are they changing? In our behavior, in our relationship with others, and in our performance, like in school and at work. And what's important to know about this is that while we might have reasons that these things have changed, and we'll talk about a big one in a minute, COVID has changed this. This is really feeling really hard because of the lockdown. Those are all very real reasons. But having a real reason doesn't keep you from needing mental health services. That's a very good reason to go and seek services. And it's also a good time to think about how to build your resilience during these tricky situations. We call treatment biopsychosocial for a reason. The biological part is that many people benefit from certain medications or biological treatments for mental health. The psychological parts are both receiving psychological or related services, but also thinking about things like our thoughts and our feelings and our behavior. And the social part is because as we go through what we call too much, it affects the people around us, or as they go through it, it affects us. There are also parts in our social life that can absolutely increase our experiences of anxiety and depression. Let's take COVID-19, for example. In all stages of the restriction and reintegration and then restriction again, there are many situational things that can worsen or exacerbate our mental health. It's hard to be apart. One of the wonderful people that I see through the telemedicine clinic said, I miss hugging my friends. It's not the same to only see them on FaceTime. Our personal situations may have changed. And importantly, while we need to keep aware of the situation, watch how some of the things in the media and other places can sometimes worsen our own experience of something like living through COVID-19. I am part of the response that the Royal has to the pandemic. And one of the things that I started to notice is the minute that I woke up in the morning, the very first thing I looked at was the public health graphs of the numbers. Now, before a pandemic, I did not start my day looking at graphs or thinking about case counts or any of these things. But very quickly, I noticed that if the first thought in my mind every day was how many active cases of COVID are in our region, it changed my thinking for the next hour in my day. So now I give myself a couple of minutes to think of other things, and then I get to the business at hand of facing COVID. Watch and see what the media and other influences do for you. Now, there are a number of things that can worsen our mental health a bit, which lower our resilience. This is not a list where I'm giving you a lecture, but this is a list where I'm asking you to think about your own patterns and perhaps if they're changing, particularly during COVID. Watch your diet. Simply put, watch what you eat and when you eat it. Same goes for caffeine use. Watch how much you use and how close you're using it to times like trying to fall asleep. Nicotine, alcohol, and drugs all contribute to lower mental health. Watch and see if your patterns are changing and start to consider some harm reduction strategies if your use is making it harder for you to cope with the demands in your life. If it's harder to get up that 8th time from a 7th fall or build resilience because of some of this. Sleep can be very disrupted, particularly at a time when we're going through adjustments like things like COVID. There are some very good tips that are available about what to really watch with your sleep. But importantly, try to keep your sleep routine as similar as you can. Go to bed and get up at the same time. Watch the quantity and quality of sleep that you have and speak to health services and counseling services if you're having difficulty with your sleep. It is an important basis of building your resilience. Your screen time is also really important. You need a couple of screen breaks. It means you can't go from Zoom onto Netflix. It's always so interesting that really interesting show in Netflix, if you look in the bottom corner when it ends, it'll restart the next episode in just a few seconds. It's almost not enough time to consciously hit stop or pause or take a break from a screen. But experiment with that. Try to give yourself a bit of a screen time break, particularly at least half an hour before you go to sleep. And if you wake up in the night, do not make your phone the thing that you reach for. Watch your patterns of isolation, or watch who fills your time and how they support your mental health versus drain it. And importantly, watch other patterns in yourself. What are some things that would tell you if your ability to cope is in fact changing? Now, this is a list of things that can often make things worse, but there's also a list of reminding yourself of things that can make things better. So we talked about how do you spend your time, both scheduled and unscheduled. Even in what seems like really open time due to the pandemic, a schedule can really help. Being engaged and present when you're in class, when you're at work, when you're other places, really lean into your experiences rather than just sort of passively listening. Setting goals for yourself of all sizes. They don't have to be big life goals right now. Things you'd like to accomplish in a day or a week, things that you'd like to try, new opportunities. Watch with whom you spend your time. Give yourself a daily challenge. There's some interesting research that suggests that if we ask ourselves something that we're going to try in a day, even if it's something quite small, it gives us an opportunity or refocuses our time and attention. So what's your challenge? It might be a new schedule. It might be a new opportunity. It might be a new skill. It might be a new recipe. What's something that you could try? One of the most interesting pieces of research about low-lying levels of depressive symptoms is how we think about and reflect on our life. Spend some time reflecting on your day, and as hard as it might be, find one thing for which you can actively practice some gratitude. And I don't mean that as an empty statement. There's some research to suggest that really reorienting ourselves towards gratitude really helps and helps us get a little bit of perspective and some consideration of our circumstances. Some days that's really hard to do. Some days the only moment of gratitude I have is thanking the universe that the day is in fact done. But find something for which to feel some gratitude. And have some daily considerations of the wider world. We are all in this together, and I don't know your circumstances, and I hope that you get the support that you need. But sometimes we need to remind ourselves that we are all in this together, and when we can reach out and support others as well. Now, the second day is to address. When I decide that too much is too much, what are some of the options and considerations I've got for addressing mental health problems? You may have seen this before, and some groups such as Alcoholics Anonymous use this, but I think it's really important to think about this expression or this saying when you think about approaching mental health issues and receiving mental health care. Accept the things that you can't change, have the courage to change the things you can, and the wisdom to know the difference. You can change a lot of your perspective on resilience and your mental health by receiving care. So the evidence would tell us that there are a number of different things to do to address our mental health. There are lifestyle considerations, which I spoke a little bit about, but balance is important, that notion of how do we spend our time. There are treatment options. It's important, and I'm going to speak on the next slide about some of the opportunities you have as a fortunate Algonquin student for treatment. There are self-strategies. There is very good reading available, and much of it's online about mindfulness, coping, meditation, and building resilience. And for those who need it, medication is also an evidence-based option for care. Now, there are certainly some websites that we recommend that help you monitor some of your own experiences to help you know when is too much too much. There is self-care that we've spoken about. There's the Distress Center. You have very active health services and you have counseling services. There's also the partnership with the Royal, and the Royal in and of itself has many services that are also available to the community. So the third A, adapt and achieve. And for many people, this is keep building your resilience. So you've been aware of what's happening for you. I hope you've also been aware of times that you have been resilient, where you had a big fall and you got back up and you kept going. So how do you keep building those opportunities? And what do you think about? And what are some of your considerations? Here's what I'd like to challenge you to do. Two different things. One's going to be a set of considerations, and the other one's going to be what I call building your resilience tree. In considering an adaptation and achieving, I want you to remember that you are here in this moment, which means that you do have some coping strategies. You might like to polish them up, you might like to get more, but be proud of the fact that you've gotten to this point. You can adapt to some new coping strategies and remember the ones that you've got. And reflect on the benefit of learning some of this. Oftentimes when we give these talks, people actually feel really hard on themselves afterwards, saying, oh, I should have done this, or I should have known this, or I should have. No, there's no such thing. It's building and going forward from very serious events or small events like me in the snowbank. And look for other people and how you support them from your experience. If you've ever been on an airplane, the first time you went on it, you might have been a little bit surprised by the announcement, because the announcement tells you that you put your own oxygen mask on first, and then you help another person. And that might seem like that's not very supportive, but in actual fact, it's a brilliant reminder for life, because the reminder is that you will only be able to support others when you've also taken care of yourself. Build your resilience, and you are of much more value to everyone else that you care about. So let's talk about how you achieve that. How do you build your resilience tree? So I'd like you to take a piece of paper, a drawing app on your phone, the underside of a receipt, or something you've got available to you, because you're going to do a little bit of a sketching exercise. You won't show it to anybody else unless you ever choose to, and it certainly isn't going to go up for any art awards. This is just for you. But you are going to draw and build your own resilience tree, similar to this diagram here. And why I like this diagram of the tree is if you look at it, you will see that it is actually people that form your resilience. You and your attachment to the world is a big part of building your resilience. So in drawing your resilience tree, you're going to draw a tree trunk. And this is what grounds you. A trunk is an important part of a tree. And inside that trunk, over time, not just in the next few minutes, you're going to keep revisiting this diagram, and you're going to write out what are some of your skills and your values, the roots that you care about. What are you proud about in yourself? Okay? Keep coming back to this diagram and adding to that trunk. Make that trunk stronger and stronger by the things that you are proud of and what grounds you. And then you're going to go to the branches of the tree. And these are all different branches, and only you know how many branches you've got on your tree, but these are the different environments that you're in. School, work, clubs, your personal life, any different place where you are. These are the places where you're going to practice resilience. You might have a particular need to practice resilience in a tough class or in a challenging job. You might have your resilience very well practiced in a class where you're doing really well, or something really clicks for you, or a connection with a professor. In a club that you lead, in a club that you just joined, you know your different environments, your family, your friends, and others, and this is where you're going to practice your resilience skills. And then on that tree are leaves. And on those leaves are the skills or strategies, the habits you might want to change, the coping strategies you've already got, the fact that you're going to remember my point about gratitude, the fact that I hope you're going to remember my point about sleeping, all these different things I want you to think about and practice. Some of them might be very well practiced, but some of them might need a little bit more work. And that's okay. Be really honest with yourself. It's your tree. But the more leaves that you can put on this tree to remind yourself of all of the skills or strategies you want to develop or change a bit or polish up, the more those branches are going to look full. And the more branches you have, the bigger the resilience tree you've got. So you start your drawing and you go back to it. You set a date with yourself. Let's call it Thursday at lunchtime. Thursday at lunchtime for the next 6 weeks, I want you to pull out your tree. Or Friday morning or Sunday night, I want you to pull out your tree and just keep adding to it. And as you pull out your tree, I want you to do some reflection. Have you been practicing some of these things daily? Which of the skills do you use the most? And how effective are they? What can you add? What's that challenge you'd like to add? What do you need to subtract? What are you noticing? And then most importantly, what does resilience look like for you and how does it grow? Now, doing this sounds simple, but I promise you it's hard work because this is a really honest look at yourself about the things that you can be proud about and the things that you'd like to change and the opportunities to seek other services if you need that support or to support others to seek other services as well. The most important parts of building resilience are this: remembering that your tree and what's important about your tree, the wind isn't going to break it. That tree bends. Be reflective, be forgiving of yourself and others, be flexible like this tree, and be proud that you've started this hard work. In my house, this is on the fridge because when we have a tough time, what we try to remind ourselves is that failures and doubts, in fact, build our resilience. You're unstoppable because you continue on despite them. Building resilience is not an insurance policy. You're never going to have a tough time. You're just going to face it with a different level of skill and a different level of confidence. Thank you very much for your time. I look forward to our discussion. I'll leave you with this last slide. The foundation of the Royal is really looked at a lot of different ways to get the message out about changing stigma. So they've got a contest coming up, which is a video contest. You can see the information on this website, and they're hopeful that many of the talented Algonquin students will enter. Thanks so much.
Thank you, Dr. Farrell, for those comments on the 3As. We appreciate your perspective there. We've seen some really good information being posted in the chat about some different services and information for people attending the webinar today. So that's please have a look at those. They're excellent. We would ask if you have a question, if you could put your question in the Q&A section, and we'll read them as we get them and give Dr. Farrell a chance to give us her thoughts. Perhaps while people are putting their questions in the Q&A tab there, Dr. Farrell, I have a question for you, if that's okay, just to start us off.
Certainly.
I was thinking as you were going through your presentation, what's, often we focus on things that we can't control. You mentioned the morning numbers from Ottawa Public Health, for instance. How can we focus more on things that are within our control and not things that we can't impact or change? What tips do you have for that?
A very good question. There's an interesting piece of psychology research that says if we tell ourselves not to think about something, we're guaranteed to let our minds go there. So in the next 3 seconds, what's most important is I do not want you to think about a white bear. So what picture came into your head, right? We all just thought about white bears. I mention that because if we say to ourselves, I got to change my thoughts, I'm not going to think about this anymore, we're still pulling our attention over there. Instead, let's challenge ourselves to say, I need to change my thoughts. So in the morning, I need to think about something different than the COVID numbers. I'm going to give myself some alternatives. So I no longer wake up saying no COVID numbers, because I'll go over there. I'm going to think about 3 other things. So in my case, I think a little bit about the day ahead as number 3. Second thing I think a little bit about is the weather. For some reason, I'm fascinated by the weather and I'm always interested in knowing what the temperature is. But most importantly, I think about what am I going to cook for dinner? Because I'm learning to cook. I'm not as good as some of my friends, but it just gives me something totally different to focus on. All of this lasts about 25 seconds, but it's enough of a break that I've changed my thinking for the start of my day.
Okay, thank you. I appreciate that. We have a couple of questions appearing in the chat, so I'm going to read the first question.
Great.
The first question says, I went through domestic violence and going through a divorce and discovered I constantly have headaches and sleep less. Should I be worried, and what can I do?
Well, very good question. My first hope for you is that you are continuing to be vigilant, that you are in a safe place, and that your physical and psychological safety is guaranteed, or at least reinforced by the environment that you're in now. Keep an eye on your sleeping and your headaches. If they are really changing, then I'd encourage you to have a conversation through health services. Understand if there are physical things that need to be monitored, and understand if there are psychological things, such as the ability to talk about your experiences and or to develop some new strategies in dealing with memories or other things. Most things like headaches and sleep challenges have multiple different reasons for why they occur. And so it's important for you to have all of those opportunities investigated. One of the tremendous advantages you would have as an Algonquin student is how much is available to you in terms of getting that investigated.
Great, thank you. Our next question is from Jeff Agate, one of our employees at the college, and he has asked.
Hi, Jeff.
Jeff has asked, in your experience, Dr. Farrell, how does attending college challenge resilience, and how does it provide opportunities to develop it?
That's an excellent question. And I'm not an expert because the oldest child in my house is just about to graduate from high school. So we have a lot of conversations about resilience in post-secondary life. And I'm learning really quickly as a mom what it means to build resilience and how individual coping strategies and resilience are. I think what's really important about a new environment like going to college, whether we've been there for a few years or a few months, is to notice that if we're starting to feel like too much is too much, to reach out and not isolate ourselves. Often when people are going through tough times, they really tend to isolate themselves. And what's available from what I've noticed on your campus is many different opportunities to reach out, either to talk to a peer who's going through a similar challenge, to talk to a course instructor, to talk to support services, health services, and others. So there's lots of other opportunities there to talk to someone. I have never seen resilience develop or strengthen by isolation. It always involves linking to other people.
Thank you. I think that last comment was perhaps one of the most important, just that we can't cope with challenges in isolation and we need to reach out to other people. And that's a great reminder for all of us. We have an additional question here. It says, do you have any tips for supporting others in their journey to being resilient without draining yourself as well?
It's a great question. Well, there are a couple of considerations. And one is that we all have a different amount of time and effort that we can give to other people. And we need to be aware of that. We need to be honest with ourselves about that. And we need to know how to set a boundary when we're being tapped out, right? So for some people, they're quite comfortable talking to their friends or to family members or others for quite a long period of time. And other people just want a little bit of soundbite talk or support. So first, know that about yourself. If you're noticing changes in your irritability, your sense of being overwhelmed by taking on others' problems or those sorts of things, or you're finding yourself in a cyclical conversation, you've probably gone overboard for what's going to feel comfortable for you. We also have to remember that other people want support in other ways. So I have friends who support by really listening to me, and I have friends who really support by doing awesome things like sending me an article to take a look at, or sending me a joke, or sending me the picture I'm supposed to take to the hairdresser to tell her what to make this look like. We do support people in different ways, comical and serious. Know for yourself if it makes you feel a little better when you do that support, or if you're starting to feel a little drained. if you're feeling drained or you feel like you're holding your friends or others' problems, it's a good time to have a professional come in and support them as well.
Great, thank you. We have another question here. It says, are there ways where being resilient can be detrimental? For example, remaining in a toxic workplace or an abusive relationship too long because you are more resilient?
That's an excellent question. There's a business professor at Carleton named Linda Duxbury, and she talks about frogs in water. And the example makes a lot of sense to me. She says, many times we're like a frog in a pot of water. Now, forgive me if you're a fan of frogs. This gets a little bit graphic. You're a frog and you're in a pot of room temperature water. And what actually is happening is that the pot is a saucepan that's on the stove and the dial's going up, the heat's going up, but it goes up slowly. Things at work get a little worse. Things in your relationships get a little harder. They don't usually go from 0 to 100 in a minute. It's a slow climb, right? So the frog that's in the water kind of gets used to it. If you take a new frog and you drop them in that hot water, they go jumping out. They're like, no, thank you. This is a toxic work environment. This is a terrible relationship. This is a friendship with no limits. No, thank you. But the frog who's been in the water for a long time didn't know to jump out because he or she just got used to that water. So what's important is sometimes ask yourself, what would a frog or a person, how would they react if they were coming new to this situation? If they would jump away, that's usually a sign it's time to make a change.
Thank you. That's a really good way of looking at that particular question. We have another question here. It's an anonymous question. It says, I just had a breakup with my boyfriend. He is marrying someone else, and simply I'm not able to accept change and I cannot sleep at night. What to do in such a situation?
I'm sorry to hear that. That must be very sad. My first thought, without knowing any of the details, is I don't think I would cope with that one alone. I think I would consider what options are available to you through counseling services and health services to talk about the sleep part of this, but also to talk about your feelings and to talk about what your life will look like at the time when you're ready to be in another relationship.
Thank you. Those are all the questions we have currently in the chat. I have an additional question if we can, if I have that luxury of asking you. Often we talk about, changing the way we think about things or the way that we view things. What are some strategies for doing that? Because it's harder to do than just to say it, right?
Absolutely, absolutely. And I have a colleague who uses a great expression. So I can be known for worrying about the same thing and it'll stay there. So to your good question, how do I change that? And she'll say, you're giving a lot of free real estate to this problem. You're letting it live in a very big part of your head. So sometimes the first part of changing is even just noticing it. I kind of need her to point out that the real estate is growing. So I need to, as somebody just wisely put in the chat, I need to be aware. Like, how big a piece of real estate am I giving this? And how often are tents getting set up on that real estate? So how aware am I of the thoughts and what they're doing? And the first clue to knowing it would be a good idea to change a thought is how it impacts our feelings and our behavior. So our thoughts are actually really closely connected to our feelings and our behavior. So how does this thought make me feel? What does this thought make me do? Are any of those things easier to change? For some people, it's really hard to change a thought. It's easier to change a feeling or behavior. We talk in psychology, in counseling services about a triangle. Your thoughts, feelings, and behavior are all connected. So experiment with what's the easiest one to change. In the case of the real estate, my feelings are the easiest to change because she always makes me laugh when she tells me that. And then she reminds me, yeah, I need to be a little more aware of this. And then I need to address it. So I need to think, why do I keep coming to this exact same thought all the time? And what would be the evidence for or against it? How likely is it that this is going to lead to this disastrous outcome that's on my mind? Not sure. And how do I address it by talking it through with somebody? What do I do with that? Then to the point of adapting, when the thought shows up again and it's ready to pitch a new tent in my mind, how can I decide to do something different? Maybe I adapt my behavior. Maybe I change my response in a situation. If I'm in a usual pattern at work or somewhere else, how do I just do something a little bit different and notice that the change in my thoughts will come along with it?
Thank you. I like the imagery there of the real estate and how much time and attention we give it and the tent. Thank you. We have another question. It's an anonymous question in the Q&A section. It says, setting a goal is important. If I'm not very sure whether my goal is suitable or practical for me, I feel not that motivated sometimes. Are there some good suggestions for this?
Excellent question. I'm going to tell you a topic to look up on the internet. I can't tell you the name of a website. There is a theory behind goal setting called SMART goals, and SMART is an acronym. Some of it I'll remember, and of course, because I'm on the spot, some of it I will forget. But it's the idea of having a specific goal, it's measurable, it's achievable, it's realistic. I think T is something about timing. Like the goal can't take 300 years. Can I get it done in a certain amount of time? SMART goals, when you look them up, give you a series of questions to ask yourself. So you don't have to say yes or no is your goal specific enough. It'll guide you through some thinking about that. Measurable, how will I know if I'm making any progress on my goal? Achievable, that sort of thing. So look up the framework of SMART goal setting. There may be other frameworks that you notice as well, but that's usually the first way to start. When I'm setting a goal, that's a way to help to frame that a little bit. Oh, I'm delighted to see that your college, I'm not surprised, has a goal setting worksheet there as well. So there are lots of really good resources around goal setting. And then motivation. One of the interesting pieces of research around motivation is making sure that we don't keep our reward schedule so far spread out that we don't notice what we're doing. So here's an example. Let's say my goal is to do daily exercise. Well, if I only reward myself when I make the Olympics, let's be crystal clear that I'm never going to get rewarded. I am not going to the Olympics, possibly never even as a bystander, but certainly not as an athlete. So I need to motivate myself by putting in small rewards, even if they're gratitude and other recognition much earlier. So if I get through 2 days of exercising in a row, that's worth a pretty good congratulations to myself. Or maybe I'm going to do something, or I don't know, watch Netflix. And everybody's rewards are different, but the point is our goals sometimes fall down because our motivation is spread so far apart to reward ourselves about it.
That's a really, really good point. Thank you. I have a question here that's come from someone that's going to be working in the healthcare profession. And they've said, as a healthcare professional working to teach others to use these principles in their lives, how do you ensure that you are following it for yourself? Do you do anything to help separate your work from personal? And they've made a comment, I'm going into a supportive healthcare field and sometimes worry about burnout.
It's a brilliant question, and that would be the most honest question, wouldn't it? Because you would hope that I would have a very high level of resilience and never be in the wrong part of the stress curve, except I'm a human being. So I'm often in the wrong parts of the stress curve, and I'm often needing other people to remind me to put a different perspective on things to grow my resiliency skills. So what I do to keep it really honest for myself is I do that reflection. I think back on my day, and I think about something that went okay, and I think about something that I'm going to keep working on. And I go back to a version of the resilience tree. And sometimes in a tough week, I have tons of leaves because I got tons of things I want to grow and change and develop. But then I also have to look and reflect when sometimes it worked okay, or that I'm going to give myself permission to call it okay because we got through something challenging. I also find in helping professions, there's a tremendous importance in remembering that you're part of a team. So I work with phenomenal teams, all kinds of different teams. And the gratitude I have for the dedication and hard work of my colleagues often gives me tremendous balance as well. And then you look outside of your life and look at the things that are important. And for everybody, that list is a little bit different, but they're the reminders to do things a little bit differently. I didn't really want in my late 40s to become a downhill skier. I don't like speed and I don't like heights. Would be terrible qualifications for being a downhill skier. But my eldest daughter is a wonderful downhill skier and instructor. So it's really important. So part of my balance comes from not being a chalet parent, but being the parent who falls 800 times but gets up 801. So sometimes work-life balance is looking through how the people that matter to us, how they were hoping we'd spend our free time. And that keeps us grounded too.
Great. Those are some really good examples there. Thank you. I have a question here in the Q&A. It says, forgiving, being tolerant and empathic towards others today is very much needed. How can one adopt that for himself?
I'm sorry, I didn't hear the last part of it. How can one
adopt that for herself or himself?
It's a good question. It's a question I actually heard debated recently about some of the politics that were happening south of the border and how forgiving should the world be. And there isn't one answer to any of that, politics or in our personal lives. Forgiveness is personal. There are some things that maybe can't be forgiven, and there are other things that we know need to be. So usually the start of that is deciding who can we safely speak to about an event, to decide how we process the thoughts, feelings, and behaviors about something to know if it meets the threshold of being forgiven. Tolerance is interesting because one of the issues there is, what is it we're being asked to be tolerant of? We would certainly hope in this society right now that we could develop tolerance for a broad range of characteristics of individuals. By the same token, when we're experiencing anxiety and depression, that irritability, that's a really common symptom, makes us feel a whole lot less tolerant of others. So try to understand where your intolerance is coming from. Is it coming from exhaustion? Is it coming from disappointment about the place we're at in the pandemic and COVID fatigue is a popular expression, or is it coming from another place? And then building empathy is a really important one as well, because that's different for everybody. There's no one recipe to become more empathic, because it's how do we genuinely connect with another person? And we are differently empathic with almost everybody that we know. So ask yourself what understanding you can offer to somebody, what support you can offer to somebody, and when you want to put a limit on that. Some of these things can be really useful to explore through peer support forums. They may be explored in counseling services, and they might just be explored by watching your own relationships with others and watching to see how they make you feel. It goes back in some ways to the boundaries question as well. How do I feel in this relationship? And am I giving what I want to give and receiving what I want to receive?
Thank you. I have an additional question. There's no more questions in the Q&A, so if people have a question, please take a moment to add it to the Q&A. But I have an additional question, and it's really around stigma. I'm conscious it's Bell Let's Talk Day this week, and it's our Mental Health Awareness Week on campus this week. I know the Royal does great work with the Do It for Darren campaign to reduce stigma as well. We did some research of our student population in the fall, and a number of students didn't access services. And when we kind of asked those students why they didn't access services, I think it was about approximately 21% said they were too embarrassed to reach out to services for mental health support or health services, etc., or accessibility support. What recommendations do you have, and what kind of work has been done by the Royal around reducing stigma and encouraging people to engage in the services that they really need?
So very good question. And I think there's a couple of different things, and I've seen Algonquin do it well, and I think our partnership does it well. So telemedicine is designed to do a couple of things. One is designed to make services more accessible to people, but it also can reduce stigma for people who do not want to physically present in certain locations to receive care, right? Virtual care is an option for people to receive care in the comfort of their own home or another location. There used to be conversations, in fact, there's been research done about what should waiting spaces for mental health services look like? How big should they be? Because maybe you don't want to run into 6 of your neighbors while you're in the waiting room and we're all there for this. It's not like seeing your neighbor at the dentist. Should be. It's even more common than dental problems. 1 in 2 or 1 in 5 make it pretty common, but it's still not that. So we do things through telemedicine. We try to do things through public education. There's been some important work from communications in our foundation about You Know Who I Am. people who would have more of a public presence speaking about their experiences. I ask people when they think about stigma to remember a number like 1 and 2. I don't know how many people are on with us today, but let's divide ourselves 50%, right? At least half of the group is going to have mental health issues, problems, diagnoses needing services at some point. It would therefore not be in our best interest to cast a shadow on any of that work. We're going to keep a lot of people from care. We're going to keep a lot of people from care if we don't have the conversation about what it's like. And when I work as a psychologist, the thing that strikes me the most is when I'm describing to somebody what they've been coping with really admirably. It has a name. It's called depression. It's called anxiety. It's called trauma. The sense of relief that people feel that their experiences are not all in their head. You know what? It's not in your head. It's in your head. It's in your heart. It's in your life. It's in your relationships. Mental health is everywhere. And everyone deserves to have better mental health than most people do. So if we could get comfortable with talking about our own struggles and comfortable hearing what others need, not that we can always solve it as their friend or family member or colleague, but that we can encourage them to go to professional services, I think we'd go a really far way in breaking stigma.
Great, thank you. I'm conscious we have a couple more questions have come in, but we're almost at our time. We've perhaps gone over the time we'd allotted for the questions. For those that had additional questions, I would point you to the resources in the chat and to the resources around mental health on the Student Support Services website. You can find links to health services, the different clinics with the Royal, the counselling services, and the Centre for Accessible Learning, and all of which exist to support students with their mental health. So we encourage people to look at those resources. Dr. Farrell, thank you for taking questions. I know it's always a bit nerve-wracking taking questions. Never know what people are going to ask, but you did a fantastic job. So thank you very much. Thank you.
And I also want to thank everyone for joining us today. We have more upcoming events for the Mental Health Awareness Week, including some great ones tomorrow to acknowledge Bell Let's Talk Day. So please visit the Student Support Services events calendar to learn more about all of the events for this week, and have a great day.